Good morning, everyone. Welcome to Brain Injury 101, the first of a three-part series, a brain injury education series, where we'll talk about an introduction to brain injury, recovery strategies, and a little bit about our organization. My name is Sheridan Knowles. I am an occupational therapist with our Compass Occupational Therapy Department at Brain Injury Services, and I'll be co-hosting today's webinar with Jess Lindquist, who I'll let introduce herself.
Thank you, Sheridan. And so again, my name is Jess Lindquist, and I'm an intake case manager here with Brain Injury Services. And thank you all for being here.
Yes, thank you all so much for attending our webinar series. So this webinar series will be recorded today, and we'll talk a little bit about where you can find that recording in a moment here. But again, welcome to Brain Injury 101. This is our introductory course on the basics of brain injury. So, who are we that you're joining today? We are Brain Injury Services. We are a nonprofit agency, and we function as a recovery partner for people with brain injuries who are living in the state of Virginia. So, we have a lot of departments outside of occupational therapy and case management that function to really work with our clients individually to help repair lives, recover possibilities, search out resources, and restore hope for those living with brain injury. On the right side of this slide, you can see our service area. So we cover quite a wide range of the Northern Virginia area. So if you're interested in connecting with us, our website will be at the bottom of every single slide on this presentation, as well as our phone number at the bottom of this slide here and an email to get in contact with us. So thanks for joining us today and for supporting us. So, as I mentioned, this webinar will be recorded, and we are hopeful that this webinar, along with part two and part three, will be available on our website by mid to late August. So, we're hoping that these will be accessible quite soon. It's currently July 2026. For those of us who are joining us live, look out for that webinar. So you'll go to our website, which again is posted on this slide, access the resource tab, go to our webinars tab, and then this will automatically take you to our YouTube channel where you will find not only these webinars, but additional webinars. In fact, there is a Brain Injury 101 hosted by our very own Jess Lindquist that is about a half hour long that is geared towards professionals working in the healthcare industry and supporting individuals with brain injury. So I believe the YouTube link is going to be dropped into the chat right now. And again, please access our website for additional webinars. So, down to it today, again, we're talking about Brain Injury 101. If you're with us live today, it's Wednesday, it's 11 o'clock. We are going to be hosting part two and part three in the consecutive weeks, same time, same place on Zoom. So, next week at 11 o'clock on Wednesday, Brain Injury 102, where we'll learn about holistic wellness and recovery strategies. And then the following week, our Brain Injury 102 or 103 webinar, where we'll review what's offered at Brain Injury Services. We'll dive into those different programs that I mentioned and how we function to support your journey, how you can get in contact with us, and the nitty gritty of our day to day at Brain Injury Services. So we hope you'll join us for those webinars or that you'll access those on our website. So, for today's learning objectives, we are going to talk about the major functions of the brain and an introduction to basic brain anatomy. We'll talk about fundamental and basic brain injury terminology. We'll discuss common symptoms and the surface level of treatment approaches for those symptoms. And then we'll explore how to self-advocate as an individual living with brain injury or someone supporting someone who's living with brain injury and how to identify relevant goals. So just a disclaimer off the top here that some topics that we'll discuss today are can be challenging or distressing for some. They could bring up strong emotions or memories. Just remember that you can leave the webinar at any time, take a break, mute us, or step away and rejoin when you're ready. And just keep in mind that no brain injury is identical to another brain injury. We often use the terminology in our area of practice that you've seen one brain injury, you've seen one brain injury. So keep that in mind as some of the information that we'll discuss today may not apply to you. This is just for educational purposes and is not medical advice. So please consult your healthcare provider for any guidance on your personal health or history based on what we discussed today. And wrapping up our housekeeping today, a reminder, this is a shared learning space. This webinar will be recorded. However, no one's video or faces will be recorded on the webinar. Chat messages, which we encourage you to use throughout the presentation, will be visible to the staff that are on this call today and other participants attending live, but your name and image will not be visible on the recording. So please do use that chat feature at the bottom of your Zoom screen to engage with us today. And hopefully we'll have some time at the end for some Q&A to address any questions that you might have. And lastly, for those who are attending with us live today in July 2026, we will paste in a feedback survey that we encourage you to give us any feedback and help us to improve our webinars for the future. So without further ado, I'm going to hand it over to Jess to pick up our first topic, which will be brain injury basics.
Thank you, Sheridan. And so again, we'll kind of get started with really the foundation or the basics of brain injury and how the brain really works. And so moving forward, when we ask what is a brain injury, a lot of times we're referring to acquired brain injury or ABI, which is really like an umbrella term for all or most types of brain injuries. And so an ABI or an acquired brain injury occurs when the brain is damaged due to either trauma, medical conditions, or other factors. And these events typically occur at least 30 days after birth, and they are not part of a congenital, degenerative, or genetic condition. And so, for example, a person with maybe epilepsy does not automatically have a brain injury, but seizures can result in maybe a fall or damage over time to the brain, which would then be considered an acquired brain injury. And so under kind of this umbrella of acquired brain injury, typically they are categorized as either non-traumatic or NTBI or traumatic, also known as TBI. And so under non-traumatic brain injuries, this is a type of brain injury that occurs from an internal force, such as a stroke, a ruptured aneurysm, anoxia or hypoxia, which really means the oxygen flow to the brain has been impacted, as well as infectious disease, such as long COVID or meningitis infections that reach the brain, as well as tumors, cysts, or toxin exposure. Whereas a traumatic brain injury or a TBI occurs from an external force to the brain. And so there are two types of traumatic brain injuries. There are open and closed head injuries. And so an open traumatic brain injury, as one might expect, this could include things like a skull fracture, penetrating injury, or potentially even a surgery. And so somebody may have had a stroke, which then resulted in a brain injury or in a brain surgery. And so we may say that this person has both a non-traumatic and a traumatic brain injury. And really, this is why we use this umbrella term of acquired brain injury. And so lastly here, a closed head injury would include things like your concussions, which previously was called a mild TBI. Now we no longer use that terminology, and we'll get into that shortly. But there are, again, concussions, contusions, which refers to bleeding, a diffuse axonal injury, which means the damage has spread over more than one spot in the brain or one location, as well as coup contre coup, which really means when two sides of the brain have been damaged, meaning the site of impact, such as in a car accident, and the opposite side of the brain due to the brain shifting within the skull. And so starting off with traumatic brain injuries, TBIs, again, are a result of an external force to the brain. And this can include motor vehicle accidents, being hit in the head by something or against something. And the most common cause of traumatic brain injury is actually falls. And this makes up about 40% of all TBIs. And that, again, is a really large number. And so TBI is a lot more common than people think. A lot of people are not aware that a concussion is considered a traumatic brain injury. And so a 2025 study looked at a whole variety of literature on brain injury. And it showed that across the US general population, there's an 18.2% prevalence of traumatic brain injury. Now, this doesn't mean that every concussion or TBI will lead to long-term effects, but it is important to know how common they can be. And so men are generally more likely to experience a TBI according to the literature. And this is usually because men, on average, are more involved in things like contact sports, physical labor jobs, military service, and sometimes even risk-taking behaviors or substance use, which may increase their risk of having a brain injury. However, we do recognize that a significant portion of TBIs in women are underreported or untreated globally due to things like domestic violence. In addition, the highest rate of injury is among those aged 15 to 24. However, those under 5 and those over 75 are also at a greater risk of having a TBI due to things like falls. The big point here is that TBI does not discriminate and can affect anybody at any age, anywhere. And so I mentioned a minute ago that TBIs previously, a concussion might be considered a mild TBI. And so we are really moving away in the field from using mild, moderate, and severe labels because they don't really accurately reflect somebody's real symptoms, their true experience, and their recovery path. And so now the field has shifted to using this new approach, which we call the CBIM. And that stands over on the right for clinical symptoms, biomarkers, imaging, and modifiers. Um, and so, for example, somebody who previously would have been diagnosed with concussion, we might have only looked at their clinical symptoms. So their loss of consciousness, if they were feeling dizzy, if they had headaches and light sensitivity. And now we're also considering these other factors, such as blood tests, CT and MRI scans, as well as things that are very individual to that person, like their age, their sex, medical history, and other factors that can really influence their unique situation. And so this matters because now this new framework gives us a more accurate and better understanding of each person's injury without really minimizing their experience. Because as we know, a mild TBI is not always mild to that person. And so at this point, I'm going to hand it over to Sheridan again to talk more about non-traumatic brain injuries.
Thank you, Jess. So to kind of piggyback off of what Jess was mentioning about nomenclature, the term non-traumatic brain injury can be taken in a poor way as well because we're not necessarily talking about how traumatic it is for the individual who has a non-traumatic brain injury. When we say the term non-traumatic, we're talking about the force of the injury coming from an internal force as opposed to an outside force, like Jess was mentioning with traumatic brain injuries. So these injuries happen because of things that happen inside our bodies that can affect how the brain works. The most common example of a non traumatic brain injury is a stroke, also called a cerebrovascular accident or CVA. This happens when blood flow to a part of the brain is blocked or when a blood vessel bursts and the brain cells in that area don't get the oxygen that they need for a period of time. Other internal factors causing non traumatic brain injuries can include anoxia or hypoxia, as Jess mentioned, which is a lack of oxygen to the brain. So, this can result in a brain injury that's caused by something outside of the neurological system, for example, like a cardiac event, like a heart attack, or as a rare complication during a medical intervention, including surgical procedures that involve anesthesia as well. Additional causes of non traumatic brain injuries can be infections that reach the brain, tumors, toxic exposure, or other medical conditions that affects how the brain functions. So the key idea behind non-traumatic brain injury is that the brain is injured not by an external force, but by something going wrong within the body itself. So going back to the most common type of non-traumatic brain injury, there are a couple different types of strokes, and understanding the basics of these types of strokes can affect how we treat the stroke symptoms or individual recovery paths. So, the first type of stroke on our slide is the most common type, the ischemic stroke. This happens when a blood clot blocks a blood vessel that supplies the brain. So, you can think of this like a pipe getting clogged, causing the blood not to be able to get through to that part of the brain. So, it doesn't get the oxygen that the blood is carrying that it may need at that time. The second type of stroke is a hemorrhagic stroke. This happens when a blood vessel bursts or leaks within the brain. So instead of a blockage like the pipe, there's an overflow, bleeding inside or around the brain that puts pressure on the brain and can damage nearby brain cells. Then the third on this slide is the transient ischemic attack, or commonly referred to as a TIA or a mini stroke. This is caused by a temporary blockage of a blood vessel, and symptoms usually resolve within minutes or hours, but initially they look like the symptoms of a stroke. But even though the symptoms go away, a TIA is typically a warning sign that a real stroke can happen or may happen without treatment or lifestyle changes. So, when we think about stroke, the key takeaway here is to remember that all types involve blood flow problems, just in some different ways. And looking at the commonality of strokes, it can help us understand why they are a leading cause of long-term disability. A stroke happens in the US every 40 seconds. That adds up to nearly 800,000 strokes each year in the US, with around 600,000 of those being first-time strokes. About 1 in 4 people who have had a stroke will have another one or are more likely to have another one. And the main takeaway here is that strokes affect a lot of people, and many will need support with daily life after a stroke. So, this is one of the most common diagnoses that we at Brain Injury Services treat within our population. And it often doesn't come to mind when people think brain injury, but again, it's one of the most common causes. So, with that, getting our stats out of the way, I'm going to turn it over to Jess to lead us into our discussion on brain anatomy.
Thank you, Sheridan. And so in this section, we'll talk more about the different parts of the brain and what they do. And so starting off with the frontal lobe, seated just kind of behind the forehead there, highlighted in blue on this image. The CEO, the frontal lobe of the brain acts kind of like the CEO because it manages executive functions, including planning and organizing, task sequencing, meaning following the order of steps required to complete a task, abstract reasoning, impulse control, and our decision making. And so damage here in this area can impact our ability to use these skills to regulate our emotions, to start and finish tasks, and to stay focused and organized and tolerate the frustration that can occur while we're trying to complete those tasks. And so you might notice that these symptoms seem similar to ADHD, the attention deficit hyperactivity disorder. And that is because executive dysfunction, meaning these skills being disrupted, can occur in both ADHD and in frontal lobe injuries. And so moving forward, the next area of the brain that I want to talk about is the temporal lobe. And this part of the brain is seated kind of behind the ears. And so the word tempo helps me remember because this part of the brain is responsible for language, memory, and fear emotions. And so one common result of damage in this area is aphasia, which really means trouble communicating. And so with receptive aphasia, this person might have a lot of trouble understanding the information that they receive, and their responses may not quite make sense as a result. Alternatively, expressive aphasia occurs when a person has trouble finding the right words to articulate what they mean. Maybe it's on the tip of their tongue and they just can't think of that word. Or they might have trouble physically producing the word. And so, in addition to these communication challenges or aphasias, damage to this part of the brain can also lead to changes with things like aggression, um, persistent talking, PTSD, and that is due to the link to fear emotions. And so next, the parietal lobe sits kind of across the top of the head like a headband. And this area of the brain manages our five senses. And so it perceives, interprets, and integrates sensations communicated from other parts of the body to the brain. And so damage in this area can result in an inability to coordinate our movement smoothly, to understand where our body is in space, and to respond to sensory information in an appropriate way. And so, for example, we often see clients experiencing overstimulation due to these sensory changes in the parietal lobe. The occipital lobe, seated kind of at the back of our head, is home to our visual processing area. And this part of the brain makes sense of the information that our eyes receive and send through what's called the optic nerve, which connects the eyes and the brain together. And so this part of the brain understands our distance and depth perception. It makes sense of colors, objects, and faces, and it helps us form visual memories, meaning when we close our eyes, we can picture something that we've seen before, and that is an example of a visual memory. And so this means that damage in this area can not only impact these different functions, but it can also result in things like full or partial blindness, double vision, or other visual conditions. So the limbic area is another important area of the brain. It's highlighted here on this image in green. And this part of the brain is highly involved in our emotional and behavioral responses, especially our survival instincts, like the fight, flight, freeze response. And so damage in this area can result in us getting kind of stuck in that state of fight or flight, or dysregulation. And it can also lead to hormonal disruptions. And so the cerebellum and the brainstem are two of the more primitive or early brain areas. And so the cerebellum is responsible for our motor functions, including our movement, our balance, and our posture. And our brainstem is responsible for involuntary processes, such as our heartbeat, blood pressure, breathing, sleeping, and digesting, meaning our brain kind of handles these functions automatically, and we can do these things without thinking about it. And so when this part of the brain is damaged, it can affect how our body kind of regulates these functions. And across all of these different lobes and areas of the brain that I've just discussed, these lobes exist across two hemispheres or halves of the brain, which are divided by a groove known as the longitudinal fissure. And that's not something you have to remember, but this is more of a simplified model to really explain this concept. And so the left side of the brain is more associated with things like logic and language, and the right with creativity and intuition. And these two halves of the brain actually control opposite sides of the body, which means the right brain will control the left side of the body and vice versa. This is why maybe if someone has a stroke on the right side of their brain, the left side of their body may experience weakness or loss of mobility. And these left and right hemispheres are united, though, again, by kind of that line in the middle, which is really a large bundle of nerve fibers. And so they work together as a team, these two halves of the brain. And there is actually evidence that parts of the brain can take over or compensate for another part that has been damaged or injured. And so now that we've talked about these different brain areas, I'm going to pass it back over to Sheridan to talk about what our symptoms really can look like and how brain injury can impact us.
Thank you, Jess. So, yes, symptoms can be quite widespread because our brain controls nearly every aspect of our behavior, our functioning. So, symptoms are going to be categorized for the sake of this presentation into four categories. But as I'll discuss, these categories are not isolated from one another and they can often affect each other. So we'll talk about symptoms within our cognitive or thinking areas of our life and our brain, sensory issues, physical challenges, and emotional and behavioral symptoms. So, brain injuries can cause a wide variety of physical symptoms, but not everyone will have all of them or any of them. But some of the most common ones include loss of motor function, so trouble moving certain parts of the body, difficulty with communication, as Jess mentioned, and this difficulty can stem from challenges within our brain in, for example, producing speech, but it can also be a physical symptom if motor function is lost within the jaw or the face to be able to produce speech. This can manifest as aphasia, as problems with speaking, understanding, reading, or writing language. Seizures are also another common physical symptom, headaches or chronic pain, fatigue, sleep problems, and balance issues and dizziness. So these effects can vary widely depending on the area and severity of the brain injury. And in addition, we can also consider if there were physical injuries occurred during the injury, like, for example, with a car accident or a fall, that can also contribute to some of these physical symptoms. Next, we'll discuss sensory symptoms. And brain injuries can affect many of the senses, even if the eyes or the ears or other sensory organs themselves are physically healthy. And this happens because areas of the brain that just mentioned that are responsible for processing sensory information may be affected by the brain injury, while something like the eyes are not physically affected. For example, even if someone has 20/20 vision on a vision test, their brain might not interpret what the eyes are seeing correctly, or the pathway that decides how to react to that visual information may be affected. This can lead to trouble judging distances or tracking moving objects, which, as you might imagine, are important for things like driving and other activities that we participate each day. This is why it's important to identify which areas of the brain are affected and to work with specialists who can help determine the root causes of these symptoms before we dive into treating some of the sensory symptoms that are on the screen here. So, moving forward to cognitive symptoms, these are basic thinking skills that we use every day. For example, how we pay attention, think, remember, and process the information that we take in. And when we say process information, we're really just talking about how our brain determines what that information is and the proper response to that information that's coming in through our sensory system. Some common changes that may occur after a brain injury in cognitive skills include trouble concentrating or staying focused on tasks, difficulty paying attention to tasks or activities that may have been easy to attend to prior to the injury, feeling confused or having brain fog, slower thinking or processing of information, whether you're receiving that information visually or through your ears and hearing that information. Memory problems like forgetting recent events or instructions or remembering information to complete a task, and difficulty with learning new information. These changes can make our everyday tasks like work or school or even social situations much more challenging. So changes in cognitive skills contributes to the invisibility of brain injury because these challenges can be present or even severe despite someone looking quote unquote fine on the outside. These cognitive symptoms are often very difficult to spot for individuals who even know the individual with the brain injury quite well. Often, when we discuss cognitive impacts of brain injuries, we hear the term executive functioning or executive skills. You can think of executive skills like the brain's manager or CEO, like Jess was discussing earlier. They help us to plan our days, organize things, make decisions, and follow through on the tasks that we need to complete. Some common executive skills challenges caused by brain injury include difficulty planning or managing time effectively, difficulty organizing or prioritizing tasks, thoughts, or areas of our environment, problems starting tasks or knowing where to begin, trouble staying focused on a task, difficulty finishing tasks once they are started, and challenges with problem solving or making decisions. And lastly, reduced insight or self monitoring. So, this can mean that it can be hard to notice that you're making mistakes or figure out how to adjust or change your behavior based on challenges that come up when we participate in everyday tasks. These changes can show up in everyday life in ways like missing appointments, leaving tasks unfinished, forgetting steps when cooking, or struggling to decide what to do first when you're trying to accomplish a task. Cognitive rehabilitation and adaptive strategies aim to help individuals to work around these challenges, like things like using checklists, alarms, planners, step by step instructions, or developing structured routines to help manage and support daily tasks and regain a sense of control and independence despite some of the deficits that we discussed that may be a result of the injury. So we know that cognitive challenges and executive functioning challenges, as well as physical and sensory system challenges, can all affect our emotions. So, how we tolerate the frustration of those challenges, leading to anxiety or low confidence because a person knows what they want to do, but has trouble organizing or completing it for a variety of different ways. So, brain injury can absolutely affect mood and behavior in the following ways. Some examples include irritability or feeling easily annoyed or upset, frustration when struggling with tasks or challenges, aggression or agitation, depression, anxiety, or even apathy. So, just completely losing interest or motivation for activities that you used to really enjoy. So it's important to know that many of these changes can be heavily exacerbated or caused by the brain injury. And as such, they're not personal or intentional, which can be quite difficult for individuals who support someone who's living with a brain injury to manage and to understand. Support, including therapy, which may review and teach coping strategies, can help to manage some of these challenges. And additional rehab, like I mentioned, cognitive rehab, can help to mitigate or remediate the cognitive symptoms that can also be contributing factors to emotional regulation challenges as well. And lastly, on our categories of symptoms, we'll talk about behavioral symptoms. So these are commonly related to emotional symptoms. And it's common to see these challenges in how someone controls their behavior, emotions, and social interactions. Examples can include disinhibition, which is saying or doing things without thinking, or speaking before we think, impulsivity or acting quickly without considering consequences, personality changes, which can span widely, impaired self awareness. So, back to that cognitive skill of not recognizing challenges or mistakes, poor social skills, trouble regulating emotions or feeling overwhelmed, angry, or sad more easily, and then lacking the ability to implement coping strategies to manage some of those challenges and really just feeling emotions much more intensely than prior to the injury, stronger reactions to situations than one is used to. So these changes can be frustrating for both the person and their loved ones, friends, and family, but they are a common part of recovery and they can improve with support and coping strategies, as we talked about a little bit before. So, to round out our talk about symptoms, as you'll remember in an earlier slide, we referred to brain injury as an invisible injury, meaning that for many individuals, their internal struggles can remain hidden from view to the outside observer. So we can think of this like an iceberg. Outsiders may only see the surface, such as maybe a small behavioral change, physical fatigue, or maybe a limp because of a weakness on one side of the body. However, the vast majority of the impact on the individual typically lies beneath the surface, involving complex cognitive, emotional, and neurological changes that others cannot easily see, but that have a wide-ranging impact on the individual's day-to-day functioning. So again, some of those impacts are listed on this slide, and they are not as easy to spot as one might see. So we often remind our clients of this invisible injury phenomenon that accompanies brain injury as a chronic condition. So, with the information about symptoms covered on that surface level, we will switch over and talk a little bit about treatment and recovery. So, the first thing we'll discuss with treatment and recovery is the treatment team. So, I'm not going to go through everything on this slide, but just know that at any stage of recovery, you may interact with members of the treatment team on this slide. Again, it's a long list, so you may not interact with every one of these individuals, but we just wanted to give everyone here a list of some of the most common professionals that work in the brain injury space. So, the most common member almost everyone will see following any level of brain injury is a neurologist. You may be referred to a neurologist after you visit the emergency room or after you see your primary care provider, but the neurologist is a medical doctor who specializes in the brain and helps manage medical care, monitor progress, and coordinates treatment after a brain injury. You can think of the neurologist as the coach of the recovery football team, helping to call the plays on things like medications and recommendations for health and lifestyle routines. It is important to keep the neurologist updated on any new conditions or other chronic conditions so they can adjust the game plan accordingly. So, adjusting may look like ordering additional testing, trialing a new medication, or as I mentioned, maybe a lifestyle change. Other team members, like occupational therapists, physical therapists, speech therapists, neuropsychologists, and social workers and case managers, may also be involved depending on your individual needs, but you don't and will not likely see everyone at once because it is a very overwhelming stage, especially immediately following after a brain injury in that acute stage. So, the important key takeaway here when we think about the treatment team is that they work best when they work together, just like a football team or a soccer team works best when everybody knows what the plays are. So, unfortunately, that means that it often falls on the individual who is living with a brain injury or their support network, like friends and family, to advocate for yourself and make sure that everybody has all the information so they can communicate and work together effectively to facilitate recovery. So, with that, we'll shift just to briefly talk about the recovery stage after a brain injury, and I'll turn it over to Jess for that.
Thank you. And again, we'll talk more about, recovery and some recovery strategies in our next week's session. But in the meantime, just to give kind of a foundation about this topic, one question that we often hear is, how long does recovery from brain injury actually take? And unfortunately, there is no perfect answer to that question. The answer is it depends, because the process does look different for each person, since brain injuries typically are not identical to each other. And so in the past, there have been some experts that have said, 6 months or a year or 2 years is when a person might expect to reach their maximum level of improvement. However, some recent research has kind of challenged this idea, and we're happy to share more information about this research. And so just to summarize it here on this next slide, one study found that over 10 years, they were tracking patients who had survived a traumatic brain injury. And at the 2 year mark and the 5 year mark, many of these patients still needed assistance with activities of daily living. And an example would be maybe walking or transferring in and out of bed independently. But even at the 10 year mark, some patients were still making progress. A lot of those who still needed help at 2 and 5 years we're actually functionally independent by that 10-year mark. And so, since each person is different and each timeline can be different, what this really means and what's important to take away from this is that you can still make progress for years after your brain injury. And so, in thinking about that, we'll talk more about this again next week, but we want to introduce the concept of holistic wellness. And so, you see here on the right side of the screen, there's this wheel with all these different domains or areas of life, meaning our physical health, social connections, our emotional health. And so, an important part of brain injury recovery involves increasing awareness of these different dimensions or areas of our life that have been impacted. And so maybe we're getting medical care and we're taking care of our physical health. But if our mental health is struggling or socially we're really isolated, those can be areas that, in as part of our services or maybe with other programs in the community, we can work on those areas to improve our overall wellness. And so without awareness, we can't begin to create that change. And so, as we talk about progress and changing, there's an important term that we want you to know, which is neuroplasticity. And this is really the power of the growth mindset. And what that means is the brain naturally, through its neurons or cells, they join to form these electrical pathways that power our activity within the brain. And so, in addition to other repair processes, neuroplasticity supports the injured parts of the brain that have been damaged to reconnect those routes and to find detours, so to say, or quite literally form new pathways to help us restore our functioning. And so that means in recovery, our brain can literally find a way or make one to regain those critical abilities. And so we're able to promote neuroplasticity by opening ourselves to new experiences, such as ongoing learning, maybe challenging ourselves. And so having a growth mindset helps to promote that as well, meaning we may see challenges as an opportunity to grow rather than a sign of weakness or failure. And so by adopting that growth mindset, and challenging ourselves. We can promote that neuroplasticity. We can also acquire new skills and we can support our overall recovery. And so, a fixed mindset, an example of that would be thinking that a failure is the limit of my abilities. Whereas somebody who has adopted a growth mindset, again, might see failure as an opportunity to grow and to continue getting better. And so, moving forward, we want to talk a little bit about big takeaways from today. And so I will pass it back over to Sheridan.
Thank you, Jess. So, wrapping up, we want the individuals who have attended today's webinar and who are watching this in the future to recognize that brain injury is a life-altering event that often involves management strategies for the rest of someone's life. It is a big deal. So, there are physical, cognitive, and mental health challenges that can affect individuals based on the type of injury or the severity that can be long term, sometimes maybe short term, but it all depends on a variety of different factors that we've discussed today. It's not typically a simple resolution. Being aware of these symptoms, we're hopeful that this can help you to find the help that you need sooner or to use the terminology that we've discussed today to advocate for yourself when looking for additional support. Living with a brain injury can require a large range of outside resources, strategies, and supports that we here at Brain Injury Services are experts in helping to connect you with or think through when you're deciding what goals that you would like to work on when working with us. So that's why we exist. We're here to help you find those resources, strategies, and supports. And to round out what Jess just mentioned, new learning and physical activity can go a long way in recovery, which we'll dive a lot deeper into in our part 2 of this brain injury education series. So, what to do moving forward? Advocate, advocate, advocate. This is our number one mantra here at Brain Injury Services, and we are partners in this advocacy. So, as I mentioned before, keeping your coaches up to date on health updates, any new diagnoses, medication changes, or even just life changes can go a long way in terms of how you manage the recovery journey after a brain injury. Mindset and intention matter. So keep that in mind when you're working with someone from Brain Injury Services or thinking about health outcomes in general. Remember that there's always resources out there outside of our agency as well. For those of us in the Northern Virginia area, we are quite fortunate in that a lot of community resources do exist. And here at Brain Injury Services, we are experts in finding those resources and seeking those out. So utilize your brain injury services staff. Connect with us via our website if you are new with us today or learning about us for the first time through this webinar. And just remember that you can have a big impact on your recovery and wellness. Giving up or stagnating is not the best way to move forward. You really want to remember that you do have that impact and that effect on your recovery. So, thank you so much for joining us today, either live or for watching this webinar. We will have part two in August 2026. So that's next week on Wednesday, same time, 11 a.m. So you'll receive a reminder for that. And again, if you're not watching live, you should be able to find part two, Brain Injury 102, an introduction to brain injury recovery strategies on our website and our YouTube page. So our website is listed on this slide, and someone will be posting a feedback survey within the link in our Zoom chat. So look out for that as well. So with our last 10-ish minutes that we have here, we'll turn it over to our chat and see if there were any questions that we can address prior to ending our webinar today. All right, let's take a peek here. All right, so I'll start off and then I'll pass it over to Jess too. So we had a question from one of our participants. Um, will the nerves or the neurons regrow? Are most injuries creating dead tissues in the brain, yet new pathways are formed in other parts of the brain? So I'll steal just giving a crack at this before I hand it over to Jess. I'll steal Jess's terminology in that it depends on a lot of different factors. How much neuroplasticity or neuron regrowth that we see in the brain depends on a variety of factors, what the cause of the injury was, like we talked about non-traumatic and traumatic causes at the beginning of our talk today, the severity of the brain injury. So whether there was a loss of consciousness, how long an individual was in the hospital for, and then some of those environmental and external factors that take place after the brain injury if an individual is still on that recovery path. But what we do know, as just mentioned now, is that those opportunities for growth and challenge and recovery are always out there. And it can really depend on the growth mindset and your motivation to engage in recovery activities as well, that depend on the amount of regrowth that we will see. I don't know, Jess, if you wanted to add anything to that.
No, thank you, Sheridan. That was great. And another participant did ask some additional great questions. And so one of those questions was, if the patient maybe has apathy and doesn't want to do things such as new experiences, social activities, etc., to what extent do you, quote, force that versus respect their desire to be let be? They also said, if this person maybe has reduced insight or self-monitoring and they don't recognize that they're struggling, how do you help them when they don't think that they need help? And that is a really challenging question to answer. Actually, both of those questions are challenging. And here at Brain Injury Services, our mission is really to empower clients who have been impacted by brain injury. And sometimes that can look like supporting the family and the caregiver who's having a hard time adjusting as well as the individual who's been injured. If there is maybe a client in our services who does not want to participate in a certain program or does not want to work on a certain goal, we do respect that, and that person has the full power to make their own decisions. Although it is, of course, very challenging if you maybe see that this person is struggling and maybe they don't recognize what they might benefit from. And so the best that maybe we can do as a staff member or as a family member or loved one is to just provide that information in a way that is compassionate and open, allowing this person to make their own decisions. So saying, hey, I heard of this wonderful resource or this great support group that I loved being a part of recently. I'm wondering if you might like to join that with me, rather than forcing that person to do something that they don't want to do. And Sheridan, did you want to add anything to that as well?
I think that was a perfect way to describe that. We all can relate to how much of a difference it can make when we have that internal motivation to engage in a hobby or a task, and that is really what is so important about really brain injury recovery, but engaging in any task that any of us take on is that internal motivation. So the next question that we have is living with a brain injury is certainly quite long. I struggle to tell people if I have one and how much to say. Any advice on when to discuss with a potential employer the injury, disclose to a volunteer organization or an employer? That's a great question. We address this a lot with our clients, and really, I hate to give another not so directive answer here, but it's going to depend on each individual's preference. So, of course, you can weigh the benefits of disclosing diagnoses like a brain injury or even symptoms, because it can unlock access to things like reasonable accommodations for an employer or for a volunteer setting. It can unlock things like having a job coach or maybe an occupational therapist or a case manager assisting you to adjust that job or volunteer work to better fit your needs so you can compensate for some of those challenges. However, it can also be quite emotionally taxing, and you also may face discrimination, unfortunately, for some of the symptoms or diagnoses that you have based not just for brain injury, but for any protected class of individual. So it really comes down to processing those things and deciding what's best for you. I will mention just a strategy that has worked for some of my clients when talking to individuals like receptionists at doctors' offices or going to an airport, for example, where you may have to engage in a highly stimulating environment and you're going to be discussing things with people that may not know how to engage in a way that's helpful to you. Some of my clients like to carry what we call a brain injury identification card, which can say that you have a brain injury or not on there, but it's a quick and easy card to pull out that just says, I have a brain injury. I benefit from slower speech or pausing to ask if I'm understanding, or any other variety of helpful things that someone can do to support someone with a brain injury. So, if you do find yourself in those types of situations and you just want a quick and easy way to interact with someone to get some support that you may need, getting a brain injury identification card can be quite helpful. There are websites online to do those for free, or you could just simply create one using Word or a free online software like Canva, for example. I don't know, Jess, if you had any other things to add to that question.
No, I think that's great. And there are a few different online resources that
Yeah.
can provide those free brain injury ID cards. And if that's something that you all are interested in, please feel free to reach out to us, whether it's Sheridan and I directly, or if you are a current client of Brain Injury Services, please feel free to reach out to your staff person that you work with most often, and we can help you get connected with those resources.
And it looks like the last question, um, or there two more. One was about this series and where there will there be a section on the services included at our agency? And the answer is a resounding yes. Part three of this series is all about brain injury services and the client experience at brain injury services, where Jess and I will dive deep into the programs that are offered for free for brain injury survivors in Northern Virginia through our agency. And we'll talk a little bit about what it looks like to be a client working with us and how we work with you to develop goals and priorities for your recovery journey. And our last question here is about technology. What technology are you aware of that we can use ourselves? So, unfortunately, that is a whole three-part, five-part series webinar in and of itself when we talk about technology that is available. And there's it really varies based on like the symptoms that we talked about. If you are interested in learning more about assistive technology, I would encourage you to please reach out to us. Specifically, our Compass Occupational Therapy program. The foundation of our program is assistive technology. We help clients to talk about challenges and technologies that can be supportive all the time. That's our bread and butter with our department. So there are lots of YouTube videos as well out there with kind of just a review of assistive technology. And we try to host webinars and groups to go over assistive technology to support activities like working in the kitchen, or assistive technology for other functional activities like reading and writing. So it's a wide variety. I will just say that there's so much technology out there that exists, and we would love to talk more with you on an individual basis to discuss some of those options. So I think that's everything from the chat today. Thank you all so much for tuning in live to this webinar or watching it on our YouTube channel. Please again reference the website that's on the screen right now, and reach out to us. There's a referral tab on our webpage and information about how to get in contact with us. So we look forward to hearing from you. Jess, is there anything you'd like to add before we wrap up today?
Just thank you all so much for joining us, as Sheridan said. And thank you also for the wonderful questions that you've asked. So if you think of any additional questions for us, please tune in over the next 2 weeks to ask those questions, or you are also welcome to reach out to Brain Injury Services directly.
Thank
So
you,
thank
everyone.